So all these people came together, many of them giants in the Palm Beach County community during the 80s and 90s, and had the vision. I thought it was somewhat ironic, 20 years later, the nation's arguing over the Affordable Care Act, and in many ways the healthcare district is, I would say, much better than the Affordable Care Act.
So Palm Beach County went to the voters, and they asked the voters of the county, would they approve subsidizing health insurance. The first time we went to the voters, they said no.
When the healthcare district was formed, the big thing that really attracted the voters was we're going to have trauma centers, and you're going to get this incredibly high level of care, and your chances of survival will increase dramatically. So when that was added to the ballot issue, we got 62% of the vote, and that's a landslide.
I was working for Palm Beach County when the thought of creating a healthcare district came up, an idea that isn't reproduced anywhere in the United States at that time that I'm aware of, and not many other locations now, if any at all. I'm just not aware. So this organization provided an opportunity for folks that are less fortunate to have much greater access to health care.
I'm just amazed how it all turned out, because it's sort of like giving birth, and you're not quite sure how it's going to work. And as an independent taxing district for health care and public health, owned and operated by the citizens of Palm Beach County and accountable to the citizens, I think it's turned out far beyond any expectations that I've ever had.
September the 7th, 1993, I started at the district. It was very interesting, very challenging, and very rewarding. I didn't know much about EMS, so that was fabulous, learning about the EMS system and trauma. The challenge was there was no automation. We didn't have a big budget, so we did everything ourselves. We typed everything. We cleaned the floors. If anything broke, we had to fix it. So those were the challenges. So we had claims up to the ceilings and things like that. But I mean, everybody worked together.
No, we went through some rocky times. But I think when you start anything new, you have to take baby steps and you have to learn what it is. Remember, we were unique. There was not another one anywhere in the country. So we didn't have any role model to follow. We became the role model.
I can remember that the first holiday party that we had was in the chief executive officer's apartment at that time. So we all could fit in one very small area with our spouses too. So yeah, it was very unique, very small. And everyone knew everyone, so it was a lot different than it is now, because you can possibly know 1,300 employees and be as close to it. But it was a very good time.
As a matter of fact, we used to have a typewriter in the office. Because I remember telling my daughter about typewriters, and she said, "What is that, Dad?"
There is no other healthcare district in the United States. And I think Palm Beach County was very visionary when they decided that this was the best way to do it, where the money follows the patient. So no matter what, whatever hospital you go to or the clinics, the funding is there.
And we've had a lot of partners. I think that's one of the secrets of the healthcare district. We did not create a standalone where we program. Our hospitals, our medical community, our school board are all involved. I mean, it's not like a standalone operation on the side. And I think that's the medical society. We have tremendous. It's a partnership.
The school nurse program. I mean, we have a nurse in every school in Palm Beach County, and I'm not sure of any other counties in the state that are that extensive of a system, where children can receive care right away. They can develop a relationship with that nurse so that their medications are dispensed properly.
Anytime you're part of something that's so meaningful, the rewards are much greater than just monetary or things. It's just a good thing. You're rewarded in a way that you can't get rewarded in any other way when you're saving lives in the background here, whatever the situation is, and whichever department within the agency is doing it, I totally support it all.
Palm Beach County Healthcare District, I think, was one of the things I was most proudest of being part of, because we were able to ensure health and good health for a portion of our population that would never have been served. And for me, that was a very big deal, just as it was for the people that we were giving health care to, for the children and the parents and so forth.
To me personally, the crowning jewel of the healthcare district is the trauma system. It is one of the main reasons why people voted so overwhelmingly in 1988 to create the healthcare district. To me, I was never thinking that I would be a patient in the system. Prior to 2004, when I was hit by a car while I was running, I was taken here. My injuries were so severe that I'm sure that I would have died if it were not for the trauma systems.
The healthcare district really has been that basic support system, and creating the hospital and creating the residency out there, and just delivering high quality care.
In the enabling legislation, it requires that a hospital be maintained west of 20 Mile Bend. So it gave a lot of people comfort that there would always be a hospital out here for folks that are somewhat removed from the coastal community. And so then later on to be a part of the construction of a new hospital was particularly satisfying to me.
One of the initial goals was to care for people who were less fortunate. Back then it was called the indigent population. I know there's politically more correct ways to say that nowadays, but basically you don't have enough money to pay for health care, and we're all just one hospital stay away, many of us one hospital stay away from financial ruin. So the healthcare district has provided that safety net for thousands and thousands of Palm Beach County residents over the years, and that's one thing I'm proud of.
The development of our health plans, that was a lot of my focus over the years, and from the creation of the member materials such as the member handbooks and the membership cards, to administrating the program and seeing the success of it, that's what I've been most proud of.
And I had a great group of enrollment staff and marketing staff that helped me grow Vita Health of over 15,000 individuals. So we were able to build it from nothing to over 15,000 members.
One of the first things that I'm most proud of, and the most significant factor, is of course our safety record. We've been unblemished in safety throughout since the start of the program. That's not necessarily the case in other organizations that are providing helicopter air ambulance services throughout the country and throughout the world, but we have been able to maintain that. And from my perspective as the manager of the aviation operations here, I think that it's the most significant factor that I can walk away with.
We created a program where we took members of our coordinated care program, they were actually receiving our services, and we employed them. We knew that they knew the community, they were in the churches and in the community and well known, and we actually employed them, and they went out into the community and helped those in the community enroll in our programs and services.
I was involved in setting up a lot of these stuff within our financial software package. Took a lot of work from us, but I'm proud to say I feel like I'm a part of the success of the district as it is today.
The district continues to move forward in being a cutting-edge leader.
The mobile health clinic is an excellent example of what the district is doing to improve access to health care.
My mother was involved in a very bad accident here in the Glades and was trauma hawked from here to West Palm Beach. So we hope we keep up in technology there and the flight service and all the good things that are done there. So there's a part of the healthcare district that serves every constituency in Palm Beach County. We want to continue to do that.
I feel that we have made a huge impact in this community and to Palm Beach County residents. And I think that it's so important that we, over the years, have modified what we've done based on the needs and the concerns that we had in Palm Beach County. And I think we've done a very, very good job at that.